Okay, so we do have problems with our joints. One example of a problem that I've talked about is in the knee. We could have, for example, cartilage tears. So types or examples of joint injuries. Where is the cartilage in your knee that can tear? That is the menisci, or the two meniscus, right? The menisci. So you could have a meniscus tear, like in one of them, okay? Oftentimes this has to be repaired using arthroscopic surgery. They might just go in with a camera and tools through holes in your knee and actually shave off the cartilage tear. Sometimes the meniscus is so bad that it has to be removed, or parts of it removed, and that is going to decrease the stability of the joint. It's going to be less stable because that helps to create a bigger articulating surface, right? Those surfaces come together better. And removal could also lead to damage to the articular hyaline cartilage. So it could lead to osteoarthritis. There's some idea that perhaps we can use stem cells to grow the meniscus, because it doesn't tend to replace itself very well, just naturally repair itself. So maybe in the future, we might be able to use stem cell therapy for that. We also have sprains in joints. And this is where the ligaments that reinforce the joint are either stretched or torn. So reinforcing ligaments are stretched in the least, right? So like if you sprain your ankle, right, it can be very painful and you can feel unstable until those ligaments or if they're too far stretched, they can come back, right? And or torn. And again, connective tissue doesn't have a lot of circulatory system, so it's not going to be able to repair it very well. So what they do is they sew the pieces of the ligaments back together, and they immobilize the joint. And so, so these actually take a little while for the stretched ones, the sprains, to repair themselves, right? So you have to immobilize the joint and not use it extensively. So it takes quite a bit of time to heal. We could also say that joints can become dislocated. So this is where the bones are forced out of alignment. So you could have, for example, disarticulation or dislocation, not disarticulation, but dislocation at the elbow, right? You could dislocate your elbow. The shoulder is a very common dislocated, the hip, not so much, right? So you could dislocate a finger, right? And you have to pop that back in order to get it aligned. And when you dislocate it, oftentimes you're stretching or possibly tearing those ligaments. And so dislocation can cause other problems in the future for joint stability. So those are the examples of my joint injuries, and we'll look at some images of those in our live class. We also have some inflammation in the joints. So I mentioned that there could be bursitis. So inflammation of the bursa, either the bursa sacs or the tendon sheaths, for example. And that is usually due to like a blow to, like, maybe you're on your knees or you land and you fall on your knee, and then the bursa will expand and your knee will get big. and they are treated with rest and ice and maybe some anti-inflammatory. We can also talk about tendinitis. So inflammation of the tendon sheaths. And this is generally due to overuse. So for example, you can get tendinitis even from typing. You can get tendinitis from playing tennis, for example, right? So inflammation of the tendons. And those symptoms generally, they will go away if you rest the joints. So these are some examples of issues that are related to joints.